Hi there. This video is a brief intro to our new Recall Planner. I want to show you how to download it, how to set it up for your practice, and how to use it. So in System 1, if you come to Clinical Reports and the Recall folder and then Overview, what we've started to do in lots of these folders now is put a link to the relevant help desk article. So if you click on this report name here, you can't right click and copy, but if you press Control and C on your keyboard, then bring up a browser and paste it in here, you'll bring up the article. This has got some screenshots and a bit of an explanation of what's what. We're going to jump to download the actual planner. Edge is trying to be helpful, but we recommend actually downloading it and probably have one version for you as a practice that you save in your server, SharePoint, whatever it is that you use, so everyone's working off the same version. You probably need to enable editing. Promise we've not tried to put any viruses in this, and away we go. So we're going to start with the first page, how are you working? And this is where you put in as a practice how you work. Now, some of this will be very static and won't change at all. Some of it you might want to change through the year as capacity changes. So the first options are about approach and to do with partly capacity. So for annual reviews, are you fundamentally trying to invite all patients? So that would include QoF reviews, monitor conditions and medication and things that you've opted into as a practice. Or is it just the QoF and the practice opt-ins? So that might be, say, you've decided to include HRT reviews. Or you might also have said we want to always make sure we're including thyroid monitoring, for example. Let's say we're going for everything at first. And same with monitoring. So you've got all, and priority only, localized priorities, or patient-specific. And if you want to read more about those, there's a separate article on that. Again, let's go for all. Next is about different questionnaires you'll be using. So let's say we are using asthma control questionnaires. Most practices are. The COPD questionnaires work in a similar way of trying to see whether we can do a review that's sort of based on notes and questionnaire answers. So let's say yes to that. Patients who need OBS only, so that's say they might need a blood pressure and a weight or something like that. And so we're going to want to say, yes, let's try and send questionnaires, see if these patients can do the work for us effectively. Medication questionnaires, that is only applicable if you've included sort of things like HRT, pill checks in your annual review process, and you've got access to prescribing. I'm going to put no to that for now. And with some of these answers as well, your practice setup will be reflected in the System 1 reports themselves. So some of the System 1 reports will return 0 anyway because of how we've configured the system for you. Pre-invite questionnaires. So this can be, there's sort of two categories here. I'll just show you briefly in System 1. If System 1 wants to play ball, doesn't seem very happy this morning, annoyingly. Let's pause and I'll see if I can sort that and then carry on. Bear with. Okay, here we are in System 1. So if I show you, for example, in questionnaires for our setup, there are a lot here that are showing zeros because as a practice, we've decided not to use those. Pre-review, pre-appointment invite questionnaires. So there's some which are about changing appointments, e.g. from bloods and OBS to only bloods. So if you opted to take this approach as a practice, it might be, for example, that a hypertensive patient submits their blood pressure, weight, height, answers questions about lifestyle, and because they've done that, they only need an appointment for a blood test. So that's what these reports reflect, and if there's no one in there, it's probably because you've either just sent them or as a practice you've not opted into the relevant choices. It may be that you have more in this section 6, which is questionnaires to gather information, i.e. it's not going to change how the appointments are booked, but it will improve the information we've got prior to that appointment. With these, there's also this suggestion to add that code if you want to give the patient 3 weeks to reply before they then get the main annual review invite. If they reply to all the questionnaires sooner than that, the system won't then kind of wait that 3 weeks still. But if you really want to try and get these answers to change these appointments, then we'd recommend adding those codes. So let's say yes to that one. And then this lifestyle advice, this is a kind of nice to do type thing. It's patients who might have, say, had their blood pressure, had the right bloods done, but at no point have they actually kind of gone through things like smoking, alcohol, and so on. And so it's a sort of mop-up work to send that information out. I'm going to put no to that one for now. In terms of invites, do you generate blood forms? So this is very much for practices where you're not doing the bloods in-house, but you're sending patients elsewhere to go and have them done. For most practices, that's a no. So let's leave that like that. Patient appointment links. I think most of us are trying to do that, finding an effective way to reduce calls in. And then capacity about sending annual review invites. So whilst most of the time we'd like to try and invite all the patients who need an invite, we all know there's times when you might have staff off or, whatever crisis hits. And so if you say no, it will advise sending invites to only those patients who also need monitoring, i.e. they're going to be needing an invite soon anyway for their monitoring. So let's just get it all done together with their annual review. For now, I'm going to put yes. The schedule then is how you want to work through the week. We've deliberately recommend sort of separating out these stages, and that's because of the interplay between them. So like I was just showing you, you might send some questionnaires on one day. Let's pick a Monday, say, and you want to give patients the chance to respond. So you've added those codes, which then means the following day, those patients won't be in the annual review invites because you added those codes. You could send everything on the same day, but if you did, those delay codes wouldn't really take effect, and you would get patients getting potentially multiple invites. So they might get invited for the annual review and also for their monitoring. Whereas, say, on the Tuesday, I send the annual review invites. Let's say on the Thursday, Thursday we'll do the monitoring questionnaires, and the Friday we'll do the monitoring invites. So if a patient on the Monday, or the Tuesday rather, gets that invite to have their blood test or their diabetes review, that will then take them out of the monitoring invites for the Friday. And Monday's probably quite a good day as well for sending annual review questionnaires, because generally they shouldn't be inviting phone calls from patients. We're not calling patients here to say, please contact us to arrange an appointment. Mondays tends to be busy enough without us sending out messages like that. So once you've put all these answers in, you're happy with them, you come to the calendar, and this top section here is now fixed for kind of the whole year. You can change it if you want. This is your calendar. So, if capacity changes, this changes. So, for example, here we've got the monitoring invites are showing as all. So basically high-risk drug monitoring, routine monitoring, for samples. Let's say I change this and go, actually, things aren't so good. We're just going to do priority. It's now sending us to a different folder and different sections. So the idea with all of this is that you kind of just work through whatever section it directs you to. So right now when I'm recording, this is in fact a Wednesday, so that's a day for me not to do anything. Not a great example. So let's just change that. Let's say I'm going to do the annual review invites on a Wednesday instead. So now I can see, based on what I've put in, it's telling me to send all 1L, 1R, 4L, 4R. So back in System 1, bring up the reports. I go to Invites Annual Review All. So 1L is the section for L for link, sending an appointment link. 1R is optional whether you want to use that, but if you want to particularly sort of chase and review patients who've not responded to multiple invites, that's those reports. And section 4 is kind of incomplete, i.e. they've had some of the review, they've not booked anything else yet, we want to chase them up to finish that off. At this stage of the QOF year, there won't really be any patients in here because I'm recording this in April, but once we get to sort of May time, you should start to find patients appearing. The list of links is very long because there's lots of different ways that we all work. Lots of these will return zeros because they're not a particular option that you use. So for example, diabetes stage 2 complex, you will only have patients in there if they have completed stage 1, or at least had a recent HbA1c. If you are doing 2-stage diabetes and you've decided to split the second stage by complexity. Some of them will have quite big numbers, so bloods and obs always tends to be quite a big number. And you'd follow the advice and it will say send annual review invite plus link. Some of them now have got more specific invites, so the asthma review one will say you'll do your asthma review. If, for example, you're using some links, but you're not using a particular one, there is an equivalent version that you can use. You can send the version that says just AST1, and it won't include the message that says, please use this link. So the idea is that you can tailor it a bit as a practice, but once you've kind of got your setup right in here, and your weekly pattern is fairly straightforward to follow it and work through it week to week. If you want to, you can also use this section here to record when it was done. I could put today's date in like that. I could put, for example, or I could just put in who's done it, MD, and if any notes, I don't even know what those might be, everything apart from X or whatever it might be. So the idea is if you want to provide and keep an audit trail of what you sent and when, this gives you the opportunity to do that, just that. Last part of the spreadsheet is this overview page. This section here is really the kind of core must-do stuff for managing all your annual reviews and monitoring, and it's really essential for the safe running of the system that you keep doing this through the year. However, we've got lots of other useful features that we'd recommend using. So, for example, there are equivalent sections for visits, for monitoring and annual reviews. How you choose to use those is up to you as a practice, but we've put what we'd recommend doing. Say, for example, running those once a week. We've also got some things like data quality. So we've got a whole little folder now for visits, data quality, and identifying patients where the coding may not be right. So, for example, they have care home postcodes, but they're not coded in the care home, or probably more likely an issue the other way around. They're coded in the care home, but their address isn't a care home. That's something we'd recommend doing once a month just to make sure your data quality is good, because that determines whether patients get invited for an appointment or whether they're on the list for a visit. There's lots more in here. We've put a kind of some notes on what's available and what you might find useful and when it might be good to do certain things. What's actually in these folders will, as always, be continuing to develop and improve with your feedback and ideas, and as you know, the NHS likes to throw new challenges at us. But we hope you find this useful. If you're not quite sure how to set it up, or you've got particular questions for you as a practice, get in touch with your project manager, or if you've not sort of recently got started and you've been with us for a while, drop an email to the help desk and we can jump on Teams and go through it with you. Hope that helps, and as ever, let us know if you've got any feedback. Thanks.